The DSM criteria for gender dysphoria has two different categories, one being gender dysphoria criteria for children, and the other being gender dysphoria criteria for adolescents and adults. We're going to begin by talking about gender dysphoria within children. So there needs to be a marked incongruence between one's experienced or expressed gender and one's assigned gender that lasts at least 6 months and has at least 6 of the following criteria, one of them having to be the first criteria, which is a strong desire to be of the other gender, or an insistence that one is the gender or some alternative gender different from one's assigned gender. Number 2, in boys, a strong preference for cross-dressing or stimulating female attire. In girls, a strong preference for wearing only typical masculine clothing and a strong resistance to the wearing of typical feminine clothing. Number 3, a strong preference for cross-gender roles in make-believe play or fantasy play. Number 4, a strong preference for the toys, games, or activities stereotypically used or engaged in by the other gender. Number 5, a strong preference for playmates of the other gender. Number 6, in boys, a strong rejection of typically masculine toys, games, and activities, and a strong avoidance of rough and tumble play. In girls, a strong rejection of typically feminine toys, games, and activities. Number 7, a strong dislike of one's sexual anatomy. Number 8, a strong desire for the primary and/or secondary sex characteristics that match one's experienced gender. I'd like to take a moment and explain what primary and secondary sex characteristics are for those that may not be aware. So primary sex characteristics involve body functions that are present during birth and that have to do with reproduction. Secondary sex characteristics are more physical characteristics that occur during or around puberty. The condition is also associated with clinically significant distress or impairment in social, school, or other important areas of functioning. I also included to specify if with a disorder of sex development. I'd like to take a minute and put in some other information here that's supplied by the DSM-5 on gender dysphoria in children. So according to the DSM, children with gender dysphoria have an increase in emotional and behavioral problems, and these look like anxiety or disruptive and impulse control issues, as well as depressive disorders. Autism spectrum disorder is also prevalent in children that are clinically referred with gender dysphoria. So now we'll talk about what gender dysphoria looks like in adults and adolescents and what that criteria is. So again, there has to be a marked incongruence between one's experienced or expressed gender and the assigned gender, lasting of at least 6 months, and having at least 2 of the following criteria. 1, a marked incongruence between one's experienced or expressed gender and primary and/or secondary sex characteristics, or in young adolescents, the anticipated secondary sex characteristics. Number 2, a strong desire to be rid of one's primary and/or secondary sex characteristics because of a marked incongruence with one's experience or expressed gender, or in young adolescents, a desire to prevent the development of the anticipated secondary sex characteristics. Number 3, a strong desire for the primary and/or secondary sex characteristics of the other gender. Number 4, a strong desire to be of the other gender or some alternative gender different from one's assigned gender. Number 5, a strong desire to be treated as the other gender or some alternative gender different from one's assigned gender. Number 6, a strong conviction that one has the typical feelings and reactions of the other gender or some alternative gender different from one's assigned gender. The condition is associated with clinically significant distress or impairment in social, occupational, or other important areas of functioning. So I included to specify if with a disorder of sex development, or to specify if with post-transition. So this meaning the individual has transitioned to full-time living in the desired gender and has undergone or is preparing to have at least one cross-sex medical procedure or treatment regimen, namely cross-sex hormone treatment or gender reassignment surgery, to achieve their desired gender. I included here the other specified gender dysphoria. So this diagnosis occurs if symptom characteristics of gender dysphoria do cause significant impairment in social, occupational, or other important areas of functioning, but do not meet the full criteria for gender dysphoria. So this diagnosis is used in situations in which the clinician chooses to communicate why the presentation does not meet the full criteria for gender dysphoria. The unspecified gender dysphoria, very similar, also applies when symptoms of gender dysphoria are present and they do cause social, occupational, or other important areas of functioning, but do not meet the full criteria for whatever reason. And it is used in situations in which the clinician chooses not to specify the reason that the criteria are not met for gender dysphoria. I also wanted to take the opportunity in this slide to add in some additional information from the DSM-5. According to the DSM-5, most commonly adolescents and adults with gender dysphoria have coexisting mental health disorders of anxiety and depression. Some differential diagnoses to gender dysphoria include nonconformity to gender roles, transvestic disorders, body dysmorphic disorders, as well as schizophrenia and other psychotic disorders.